My name is Mackenzie, and welcome to my Med Talk. Get it? Like TED Talk? Come on in. I'm here to talk with you about blood pressure medications, also known as antihypertensives. You might be wondering, what is blood pressure? Blood pressure is the force exerted on the arterial walls by blood, and blood pressure is determined by cardiac output, or how much volume the heart is pumping to the body in a minute, or systemic vascular resistance. When a blood vessel is more dilated, there's less resistance, so it's easier for the blood to flow through. There's less blood pressure. When the artery is more narrow or vasoconstricted, there's more resistance, which makes the blood pressure higher. So, if our cardiac output or our systemic vascular resistance is increased, that also increases our blood pressure. And if our blood pressure is over 140/90 millimeters of mercury, then it's considered hypertension or having high blood pressure. And today I am here to talk with you about the pharmacological ways to manage high blood pressure from a nursing perspective. Alright, so our focus population is people with hypertension. And right now I'm surrounded by risk factors for hypertension. We have excessive salt intake. We have unhealthy eating, we have stress, and a sedentary lifestyle. But one of the most important things you can do for your hypertension is modify your life and get rid of some of this stuff. So, take away the excess salt, take away the unhealthy eating, take away the stress, and add healthy eating, like some carrots, some exercise. And in addition to all your lifestyle modifications, the doctor may put you on antihypertensive medications. So let's talk about that next. Alright, so we have 6 main classes of antihypertensive that we will be talking about. We have diuretics, we have ACE inhibitors, ARBs, beta blockers, calcium channel blockers, vasodilators. The first class of medication we're talking about is thiazide diuretics. They work in the nephron, which is the functional unit of the kidney. So here is just a blown up version of the nephron in the kidney. Blood enters and it gets to the distal convoluted tubule, and this is where the thiazide acts. The thiazide blocks reabsorption of sodium, chloride, and potassium. Since water follows sodium, it also prevents water reabsorption. Your body excretes the sodium, chloride, potassium, and water instead of holding it in, which then in turn decreases our blood volume and decreases systemic vascular resistance, and then in turn it decreases our blood pressure. And so diuretics are the first line treatment for hypertension. There will be an increase in potassium excretion, so you need to look for signs of hypokalemia. Adverse reaction. We have our hypokalemia, which we just talked about, and then we also can have dehydration from our excessive water loss and our hyponatremia. Some contraindications if the patient already is hypokalemic, because we don't want to bring their potassium down even more, or if they have an allergy to a sulfa drug. Drug interactions. NSAIDs decrease the effects of this medication. Corticosteroids increase the risk of hypokalemia. Nursing considerations. Need to monitor blood pressure, their pulse, their daily weights to see fluid loss or gain, I's and O's, and then monitor for electrolyte imbalance. Patient education. It's important to change positions slowly, and patients should know the signs and symptoms of hypokalemia so they can report it to their doctor. And it is important to eat potassium-rich food and then take in the morning so you're not up all night having to go to the bathroom. And an example is hydrochlorothiazide. ACE inhibitors affect the renin-angiotensin-aldosterone system, or the RAS. And so first we're going to do a quick review of what that is, just so you can understand it better. Well, it starts with a decrease in blood pressure, which then causes the kidneys to release renin, and the liver releases angiotensinogen. So this renin acts on the angiotensinogen, which then turns it into angiotensin 1. And then the angiotensin converting enzyme, or ACE, comes from the lungs and kidneys, and it then acts on angiotensin 1 to transform it into angiotensin 2. And then angiotensin 2 binds to receptors, which then causes a stimulation of the sympathetic nervous system. It causes H2O retention, sodium and chloride retention, and then it also affects the adrenal gland, and it produces aldosterone. And these three things together increase the blood pressure. And that's the whole purpose of the system, is to increase the blood pressure. But with hypertension, we don't want our blood pressure increased because our blood pressure is already too high. So that is when the ACE inhibitor comes in. The ACE inhibitor comes and it stops ACE from transforming angiotensin 1 to angiotensin 2. So once this conversion can't happen, the rest of the cascade can't happen. ACE inhibitors. Their purpose is to relax blood vessels, which then decreases systemic vascular resistance, and then it also increases sodium and water excretion. It also prevents the breakdown of bradykinins, and bradykinins are important because they vasodilate. And then adverse effects of ACE inhibitors is the dry cough, angioedema, hyperkalemia. Contraindications is if you have had a previous reaction with angioedema. Also, it's not recommended for pregnancy. There's actually a black box warning with lisinopril, which is a type of ACE inhibitor. And so if you plan to be pregnant or you are pregnant, it's important to report it to the doctor. Drug interactions, NSAIDs can decrease the effect. Nursing. It's important to evaluate blood pressure because that's what this drug affects. Obtain baseline renal and hepatic studies. And then for patient education, report dry cough, avoid an increase in potassium in diet because we already have a risk for hyperkalemia. And do not stop abruptly. Examples are captopril, benazopril, and lisinopril. Now we're going to talk about angiotensin receptor blockers, or ARBs, and they also play a role in the RAS system. But their role is after angiotensin 2 is already made, and so they stop angiotensin 2 from binding to receptors, which then prevents the blood pressure from increasing because it stops the cascade. Angiotensin receptor blockers, they cause vasodilation, which decreases systemic vascular resistance, and they excrete H2O and sodium. And this medication is a lot of the time given if the dry cough from the ACE inhibitor is not tolerable. Adverse effect of ARBs is fatigue, diarrhea, and hyperkalemia. Contraindications is pregnancy. It's a black box warning. Drug interactions, we have lithium. There will be an increase in concentration. We have rifampin. It will decrease the effects of ARBs. Potassium, it will increase the risk for hyperkalemia, so just don't add potassium to the diet, don't take potassium supplements. Nursing considerations, the blood pressure and apical pulse rate need to be assessed before and during. Patient education, change positions slowly because you might have orthostatic hypotension, and report pregnancy because it's a black box warning, so we don't want to take this medication if we are pregnant. Examples include losartan and valsartan. Now we have our beta blockers. The mechanism of action of beta blockers is to block epinephrine from binding to receptors on both the heart and lungs. So the effect of beta blockers is a negative inotropic effect, which is when there's decreased contractions, a negative dromotropic effect, which is a decrease in rate of conduction, and then a negative chronotropic effect, which is a decrease in heart rate. And all of these three things decrease the workload and cardiac output of the heart, which then in turn decreases the blood pressure. So adverse effects of beta blockers includes bradycardia, impotence, and orthostatic hypotension. Contraindications, if your heart rate is less than 60, asthma with non-selective because it will target the lungs too, and peptic ulcers. Drug interactions for beta blockers, one of them is clonidine because it increases bradycardia, so your heart rate will get slower. Nursing considerations, you have to assess the heart rate and blood pressure before giving, and if the heart rate is below 60, you need to hold the medication and notify the doctor. The black box warning is rebound myocardium excitation, so you cannot stop this medication abruptly. Patient education, monitor glucose because this med masks the signs and symptoms of hypoglycemia, so you need to monitor your glucose. Also, do not stop abruptly because of rebound excitation. Examples of this medication, propranolol, which is non-selective, so again it targets both the heart and lungs, and then metoprolol and atenolol target just the heart. So now we have our calcium channel blockers, or CCB. The mechanism of action is to prevent the influx of calcium ions across the cell membrane into the smooth muscle. So the effect of this is that it relaxes the arteries because it prevents contraction of the smooth muscle. And when the arteries are relaxed, it decreases blood pressure because systemic vascular resistance is decreased. Adverse effects of CCBs are dizziness, hypotension, again because you have decreased blood pressure. Contraindication is any hypersensitivity. Nursing implications, assess cardiac status like blood pressure, heart rate, and evaluate for therapeutic responses. Patient education, notify your doctor if you have an irregular heartbeat and make sure to take this medication as prescribed. Examples of this medication include amlodipine and nicardipine. Lastly, we have direct vasodilators. Their mechanism of action is to directly act on the peripheral arteries, which causes rapid vasodilation. And the effect is that it's usually used for rapid vasodilation in hypertensive emergencies or crises. And this rapid vasodilation decreases systemic vascular resistance. So the adverse effect of the vasodilator is dizziness, systemic lupus erythematosus, pericardial tamponade. Contraindications is a known drug allergy. There's not any drug interactions that are significant enough to affect the vasodilators unless you're giving it as an antidote like a vasopressor. Nursing considerations, watch for excessive hypotension because hypotension is a black box warning. Another black box warning is the prolonged use of nitroprusside, which is a type of vasodilator, because it can cause cyanide poisoning. Patient education, report a headache, dizziness, or loss of hearing, or any other signs of cyanide poisoning. And then examples, hydralazine and nitroprusside. Antihypertensive for diuretics, ACE inhibitors, ARBs, beta blockers, calcium channel blockers, and vasodilators. Alright, so we will have an NCLEX review in class and you'll have time to answer our questions. But until then, thanks for listening to my presentation. Stay safe, stay healthy, and wear a mask. Bye!